Good evening, everybody. Um, Welcome. On behalf of the Alberta Association of Optometrists, I'm pleased to welcome you to your evening webinar. Thank you very much for joining us live. We're going to be recording this webinar, and the Alberta Physiotherapy Association will be sharing it with you afterwards if you want to rewatch it or share it with any of your colleagues. So without further ado, I'm going to introduce our speaker. My name is Megan, and I'm from the association. And our speaker tonight to talk about the vision care post-stroke and Alberta's pathway for post-stroke vision care is Dr. Cristy Franco. She practices in Airdrie, Alberta at a comprehensive optometry clinic. She is the lead optometrist of the vision therapy clinic at Airdrie Family Eye Doctors, and she is the president-elect for the Alberta Association of Optometrists. Dr. Franco strongly values collaboration with other healthcare providers and is a council member. Oh, it's right there too, for the AAO. And again, thank you. Thank you, Dr. Franco, and I'm going to hand it off to you.
Perfect. Thank you so much for the introduction, Megan. Yeah, I think I probably, whenever you hear bio, it's kind of funny, right? Because the person provided that bio. So clearly I could have done a little bit of a better job editing that for you. My apologies.
I think that was me. I added it. I wanted to make
Oh.
sure that we put everything in there, and
Yeah. Well, thank you again, everybody, for joining us. This is really great, really exciting. We were working on this vision care pathway post-stroke for a while, so really nice to be able to introduce it to everybody and for you to be able to see it. You will have access to this webinar after, so I have the pathway a little bit later on in the presentation. I have a few slides with just the entire thing on there, so you'll be able to go through and pause it, screen capture it if you need to, but it is also broken up into some smaller bits, so it's easier to see tonight as well. So with that said, let's jump right in here. You heard a little bit about me there. I'm an optometrist. I graduated from the University of Waterloo in 2016. I am practicing in Airdrie full scope optometry clinic there. It is a private practice. I do have the vision therapy clinic there. And then, as you heard, president-elect of the Alberta Association of Optometrists. Just a quick note about the funding of this talk. Obviously, we're putting it on from the association. So we're receiving some funding, some in-kind support for this talk from the Alberta Association to put this on for you tonight. So, what are we going to learn about? Well, I want to start with some of the basics, what we can do as optometrists, and maybe what the difference is from an optometrist to some of the other optometry or I should say eye care industry professionals, what we can provide service-wise as optometrists here in Alberta, what some of the common ocular and visual concerns there are after having a stroke, and what treatments we have available for those concerns. Then we're going to dive into the pathway itself and finally wrap things up with the Alberta healthcare coverage that we have in Alberta here, and then how you can refer to and co-manage with us as optometrists. So we'll start off with what is optometry. I know that seems like a really simple question, and for some of you, this might be a really easy answer, especially if you have an established relationship with an optometrist right now or currently co-manage patients with an optometrist. But I think it can be a little bit confusing. We have all these words that start with O. We have opticians and optometrists and ophthalmologists, and what's the difference between the different professions? So, an optician is somebody that you will see who helps pick your glasses for you and helps decide the best lens for you, troubleshoot if something isn't going well. So, when you're needing that pair of glasses, you're going to go in and see them. And some of them will also fit contact lenses, and they can help with that as well. As an optometrist, that's what I am. The kind of general way that I like to describe it is that we're the family doctor of the eye care world. So we are managing a lot of ocular health concerns, systemic concerns that show up in the eyes, but we're also prescribing glasses and medications and monitoring lots of different things in your eye. An ophthalmologist is that next level up. You can think of them on the same level as a cardiologist or an endocrinologist, that next level of specialty, especially if we're needing something very specific, as somebody who's a specialist in the cornea or in the back of the eye, the retina, that kind of thing. They are going to be on that next level. They are our surgeons as well. So, as a doctor of optometry, we finish 3 to 4 years, typically 4 years of an undergraduate degree first. Most schools are now requiring you to have that undergraduate degree before getting into optometry school. Then you do 4 years of optometry. The first year, year and a half is very similar to general medicine in the way that you're doing general pharmacology, general immunology, general anatomy, neuroanatomy, and the list goes on and on. Of course, with a little bit of a flair and an understanding for how those different things impact your eyes. We start learning about prescribing glasses in our first year, and you'll see on the slide here, I have it noted as the art of prescribing glasses. And that's because what you measure is not what you prescribe. There's a lot more that goes into it. What's the patient currently wearing in their glasses? What's their situation? For example, if they have had a stroke, what's going on with their vision, and how can we maximize this prescription for them? Because it might not be what we actually measure when we're looking at them. So lots goes into a pair of glasses. Of course, we're learning about ocular health, and we have internships as part of our program as well. A residency and a fellowship is optional after completing optometry school. You can go right into practice, but you do have to pass the Canadian board exams to practice anywhere in Canada. This is a little bit, I would say, of a wordy quote, but I think a really good one. It encompasses a lot of what we do. This is from the Alberta College of Optometrists. So, in bold there, an optometrist is someone who is educated and trained to examine, assess, measure, diagnose, treat, manage, and correct diseases and disorders of the human visual system, the eye, and its associated structures. So, certainly a mouthful, but I think it really encapsulates what we do as optometrists. And let's maybe break that down a little bit. What is it that we do? So we prescribe glasses. I think that's the really clear and obvious one for a lot of people. We fit and prescribe contact lenses. We can also prescribe all medications. So anything scheduled, topical, or oral in Alberta, we have this within our scope. We can monitor and manage ocular diseases, as well as systemic concerns that show up in the eye. Some people provide advanced treatments as well, areas of special interest like dry eye, binocular vision, low vision, specialty glasses, and contact lenses. And of course, we're co-managing all the time with other healthcare practitioners, yourselves included. We can order lab work and we can access NetCare as a little side note. We do not have the ability to see neuroimaging on NetCare, and we cannot upload anything. So if you have access to NetCare, or if you're in an office or you're in a hospital where you have that access, know that it is still really great to be able to send a letter to an optometrist, because not all optometrists are on NetCare. Our role, well, we provide the vast majority of primary vision care services in Alberta, from routine exams to medically necessary exams and emergency exams as well. I mentioned some of those specialty services as well, areas of special interest. We do a lot of the surgical co-management. So when an ophthalmologist does surgery, they might do a one-day follow-up. Sometimes it's not, sometimes it's the optometrist, but the follow-up care after that is with typically an optometrist. And then, of course, a lot of inter and intradisciplinary care. Speaking of those areas of special interest, if I'm not doing a really advanced dry eye, I might be referring to another optometrist to do that, but they might be referring me something along the binocular vision aspect of patient care. So lots here, and let's maybe look at some of this and how that relates to what we might be doing for a stroke patient. Routine eye exams, dilated eye exams, and imaging. These are the really big things that we would be doing for somebody who has had a stroke. And there's really important distinction between these different types of exams. It's really important to have all of them for a patient who has had a stroke. And dilated eye exams and imaging might be completed on the same day, or same thing, routine eye exams and imaging, depending on what we need. But each of these provides different information. And so if you are co-managing or sending a patient to an optometrist for a stroke assessment, you might see that they do a routine exam first and a dilated eye exam later. And that's because they give us different information. So in a routine eye exam, we're looking at, do you need glasses? How are your eyes working together on a surface level? So this is not a deep dive that a binocular vision specialist might be looking at. And then, are your eyes healthy? So just a very general, broad thing to help us get that information. We're doing a full history, as you would do as well. We're checking on visual acuity. We're checking on, again, general binocular vision, spectacle or contact lens requirements, and then the ocular health assessment, the front of the eye, inside the eye, around the eye, what's going on in the eye that might be a systemic indicator, and so on. So there's a lot of information here that after a stroke would be really helpful for us. Is the vision reduced because of the stroke, or is it reduced because of a vision change, a prescription change? Is the prescription change because of the stroke, or is it not? And, this really helps us to figure out more than just health-wise what's going on with the eye, what is actually happening, and also what's happening with their eye movements. As we're going to get into in a little bit here, that can also be impacted by a stroke. And a health assessment isn't necessarily going to give us that information. So a routine eye exam, really important. I wanted to take a little quick moment here to just talk a little bit about some of the technology that we have available. Again, if you've been to an eye exam recently or you have a relationship with an optometrist, you might know about this, but our technology has significantly advanced in the last 10, 15 years. And so here, this is actually one of the images that we use. It's 200 degrees at the back of the eye. This is my eye that you're looking at, just a diagram of the iris there, and of course, the hole for where the pupil would be. But when we're doing this type of imaging, we can look all the way to the back of the eye. I'm zooming in a little bit here, but the full breadth of this photo is 200 degrees. So a lot of advanced equipment that we have now for us to be able to provide a better eye exam and to help our patients who have had a stroke or other health concerns to really understand what's going on and monitor these things appropriately. So if we jump into some of that health aspect of things, dilated eye exams and the imaging. Again, this often goes together, not always. We don't have to do them on the same day. But when a patient, especially an older patient, comes in and their pupils are a little small, it helps us to get better images if we're able to dilate those eyes. So a dilated eye exam, as well as, of course, a routine eye exam, can be performed by any optometrist. They're going to be able to put drops in the eyes. That's what a dilated eye exam does. We put drops in the eyes. It opens the pupil up really large so that we get a much better view of the inside of the eye. If there is a stroke that's happened in the brain, there is a chance that that's happened in the eye as well. So health-wise, we want to really make sure that things are working properly and working well. But also, if there are things happening in the brain, we want to take a really good look at the optic nerve. That can help us understand maybe something else that's going on too. And a dilated eye exam is the best way for us to do that. Visual field exams, the vast majority of optometrists have some way of checking for visual fields in their office. If we don't have it in our office, we are required to have access to one or a referral system so that we can get visual fields completed for a patient. But of course, this is a really, really important part of post-stroke vision care. This is something that looks like what you're seeing here. This is a 30-degree visual field of a patient who has had a stroke. So you can see it's kind of on the one side. It's quite similar between the two eyes. They don't always look as clear cut as this, but certainly this patient would be struggling quite a bit with their vision. And it helps us to localize. We're going to talk a little bit about that in a moment here, but helps us to localize what's going on. As a quick note, somebody who has a visual field deficit or defect from a stroke, when they do a visual field like this to check, that would actually look the same as if they have neglect on that side, especially if the whole half of the visual field is affected. So if they're just ignoring that side versus they actually can't see it, it would show up the same here. And I should take a quick moment to say that the dark areas there are the areas that are difficult to see. So on the left side of both of those visual fields there. This is one type of visual field. Another that we would look at doing after a patient has a stroke is something more specific for driving. This is done with both eyes open, and we're going to talk a little bit more about that in a minute here. So what are the areas of special interest? I've touched on this a little bit, but in particular, the ones that are applicable to post-stroke care are low vision and vision therapy or vision rehabilitation. In low vision, in optometry, it means something a little bit different. When we say low vision in the optometry world, we mean either a significantly reduced visual acuity or significantly reduced visual field. So it can be one or the other in optometry, whereas low vision, sometimes it just refers to how clearly you see outside of the world of optometry. But people who are doing low vision are going to be looking at special devices that can help that patient to see a little bit better. Because they're dealing with it a little bit more often, an optometrist who provides low vision services is going to be a bit more comfortable prescribing Prism. And they're also going to provide some vision training in the form of things like scanning training. If somebody is missing visual field on one side, they're going to train them to get their eyes to move over into that area. We also have binocular vision or neurooptometry. This is where we're treating binocular vision concerns. Again, optometrists who are providing this service much more comfortable prescribing prism. Any optometrist can provide prism, but in those more complex cases, a low vision or a binocular vision or an optometrist who practices these will be a bit more comfortable. And a binocular vision, an optometrist who provides binocular vision will also provide vision training, but it might look a little bit different. So, for example, if a patient is having a hard time converging or moving their eyes in towards their nose, a neurooptometrist or a binocular vision optometrist or somebody who provides vision therapy would provide the training for something like that, as opposed to the scanning training, which a low vision optometrist might do, or an occupational therapist might provide as well. All right, so now that we have the basics, we understand a little bit about what optometrists can provide and what we do, let's dive into stroke and what the common visual concerns are post-stroke. Before we dive into this, I wanted to take a quick moment to highlight the importance of this. I think we all, on a basic level, understand the importance of our vision in our day-to-day lives. It plays a huge role in everything that we do, from pouring yourself a glass of water to navigating to get yourself to work to really doing anything. But important little note here is that visual disorders can directly affect our cognitive performance, or if we're really struggling with our cognitive performance already, it can make those deficits a little bit more difficult, more pronounced. So really, really important for us to know what the visual concerns are so that we can get that patient into the right hands and get them the treatment that they are needing. It'll make a difference for that patient in so many more ways than just in vision, and it will make your rehabilitation with that patient easier as well. So the visual impact of stroke is really quite large. There are many, many areas of our brain that are dedicated to some kind of visual processing. I've highlighted a few of them here. If you're looking at the picture on the left, you can see the purple line going through. That's kind of our quote unquote classic visual pathway. So it goes from the eye through the different parts of the brain and ends up in the occipital lobe in the back there, the vision area of the brain, the visual cortex. But really, there's actually, as you can see, all these other arrows, tons of connections jumping off before or after that to help us really understand what it is that we're seeing. Not just see it, but understand it, what it is, where it is, how it is, where is it in space kind of thing, and how we're going to interact with it. That movement to go and pick up something starts off with our vision and being able to see it. So lots of areas of the brain, a stroke can happen anywhere, but we can see visual impacts from many, many areas. On the right here, we've just changed our view a little bit. So we're looking from underneath the brain. And in particular, again, you can see the main pathways in the light green and the light purple there on the left and the right. But we've got these little kind of red spots or orange spots in the middle there, the hypothalamus, the pretectum, and the superior colliculus. And these areas also play a role in our visual control and our vision throughout our lives. And after a stroke, we can see issues with our pupil response or with our sleep-wake cycles or with what's happening as we try to move our head but keep our eyes in the same point. If that part has been impacted, again, just part of the visual pathway. To really hit the nail on the head here, on the top here, this is what we kind of, again, used to think of in terms of the visual pathway, very one way, all kind of in the same direction. Now we understand it to be much more back and forth. There's a lot of feedback. Everything is happening everywhere. So even if we have a really small stroke or TIA that's happened in one area, we can actually have a lot of visual impact from that. Or sometimes it's not a lot of visual impact, but it's just, oh gosh, this one thing is off a little bit, and a patient might not be able to explain it super well. If we look at it a little bit differently, we can see reaching, grasping, saccades, pursuits on the right side here. We have got our different lobes, occipital, parietal, and frontal. So again, anywhere here, we've got lots of different things where we can end up with issues in our vision, in our control of our eyes, in our understanding of what we're seeing, despite it not being directly in the visual cortex. So we know we have lots of impact from stroke. But the biggest thing that we all think of is visual field loss. This is number one by far, I think, the most common thing that we're worried about in terms of vision after a stroke. And for good reason, you can see up to 57% of patients who have had a stroke have some kind of visual field loss, whether that's complete, meaning everything is gone, or complete to one side, or partial, parts of the vision are gone, but not all of it. Um, Other than complete, those partial ones, that patient might be asymptomatic. They might not know that they're missing part of the vision, and that might be because they have visual inattention or neglect on that side. They just don't pay attention to it despite it being gone for them. But it also might not be, and if it's not the huge visual field it's not a huge area of loss of their visual field, they might not realize that that part of their vision is missing. Something seems off, something seems wrong, but they might not be able to say, hey, you know what? This part right here, I don't see it. I have no idea. And that's because it doesn't look black to a patient. When you see, I should have put something in here about this, but when you see a diagram, it's not like, oh, they see something here and they see black over there. It's almost like it's kind of blurry haze. Their brain just fills in that information. You don't know what's behind you, but you don't see black behind you. So you can imagine it like that. It's just that that's the end of their vision. That's just where it stops. And so they might not be aware, especially of those smaller changes. Where the stroke happens does change what the visual field impact looks like. So if that's an acute stroke, we kind of already know, especially now, they probably have an MRI or a CT or something that's telling us where things are. But if somebody's had a previous stroke, that visual impact might not have ever gone away. And so then we can actually do a visual field and help to isolate where it was, especially if the patient isn't able to communicate with that with us, or if they've come from somewhere else and we can't get the previous records for them. So lots of things here visual field wise. Um, I wanted to just give you a little bit of a glossary. We're not going to spend a ton of time on this. But if you end up hearing from an optometrist or an ophthalmologist what is happening in the visual field, some of these words can be pretty interesting. And so this way, I've just given you something that you can reference to. Some of them kind of make sense. Hemianopia, they're missing half versus quadrantanopia, they're missing a quadrant. You could actually also have sectoranopia, so they're just missing one little section of it. But lots of things. And as you can see on the right side of your screen here, these are examples of visual field defects based on where the concern was that happened in the brain. So we can see lots of different areas, and we can see both the same on both eyes, or we can see it in different areas. And again, depends on how close to the front or to the back we're seeing the issue in the brain. So lots of different things, and just a reference slide for you. So symptoms, I mentioned that a patient might not have any symptoms, but there are also other symptoms besides, oh, I'm missing a part of my visual field that a patient might experience. They might feel like they see people or objects too late. They might hear somebody, or they might know that something's coming, or they just think, oh my gosh, suddenly there's somebody here. And that kind of surprise is quite common in patients, especially that have larger visual field areas that are missing. So, they might be surprised. They might see somebody in the distance, and then all of a sudden it looks like they're right in front of them, or some object might suddenly have gotten a lot larger and they really didn't see it change its shape. And that could be a visual perceptual issue as well. But this can be really traumatic and really overwhelming, really anxiety inducing for these patients when they're in a busy environment. Think of a mall or a grocery store. There's so much going on there, and everybody is moving and everything is changing. And so having a visual field defect, they might just come in with something like, oh gosh, I'm really struggling in the grocery store. I just get lost, or I get really overwhelmed, or I have a panic attack. And that could be from a visual field defect that they have. It could be for other reasons, of course, as we know as well. But visual field or visual perceptual issues can certainly cause that. We might see this patient bumping into things or knocking things over. Sometimes, especially some of the smaller ones, they might say kitchen cabinets. That's actually a really common one, I would say, for some of the visual field defects that are up at the top here. So, oh, I always hit my head on the kitchen cabinet when I'm going to do things, or now when I go under the counter to get something, I always bump my head. And so that's another thing that you might see. It might just not just be, bumping into a door frame or something like that. Reading difficulties, another really, really big one that we see when there's any kind of visual field difficulty. The implications of this, again, this maybe is clear, but there's a huge impact for the patient. Our activities of daily living can be significantly impacted by visual field deficits, especially when they're larger. We do have an increased risk of falling when we have a visual field defect. And as we kind of alluded to, there's lots of mental health issues that can come along with a visual field defect as well. So when you have this visual field defect, you're having a lot of surprise, you're having some of the anxiety, you might start to get some depression as well. Maybe you isolate yourself a little bit more, you're losing your confidence, you don't have the independence because you're not seeing very well, and that can lead to that feeling of unsafety as well. So lots of different risks here. It also impacts the ability to participate in rehabilitation. We talked a little bit about that earlier. If the patient isn't able to tell you what's going on, or you don't know what's going on, or they just are struggling, that visual field defect can really hinder what they're able to do in their other therapies as well. And it does, if we leave things, just as they are, and we don't help and we don't do anything, it can have a negative impact on the long-term recovery from stroke, just the general long-term recovery as well. Those are the main things, but what are some of the other issues that we can see post-stroke, vision issues anyways? Double vision, certainly a big one. This is when somebody is seeing two complete separate images. Sometimes it's side by side or diagonal or one on top of the other. But double vision is a huge one. It can happen for many different reasons. So we need to investigate that a little bit. Lots of eye movement abnormalities, whether that's because, the coordination isn't working well, so convergence insufficiency, they can't turn their eyes in towards their nose. Maybe the innervation to the muscles around the eyes, those cranial nerves are just, they're not working. And so we're seeing a paresis or a palsy where the eye is turned in a different direction. Sometimes it's that the saccades or the pursuits, the short, quick movements of our eyes that we make, or the slow motion following ones, are just not functioning. They're just not working as well as they could. Lots of different things that we can get in terms of eye movement abnormalities here. We can also have a lot of visual perceptual difficulties. So we've touched on visual neglect or inattention. We can also have a visual midline shift. So after having a stroke, that patient isn't, identifying the middle of themselves as actually being the middle. Maybe it's off to the side one way or the other, or maybe it's not here for the middle of their eyes. It's looking like it's up or down a little bit. And that's really going to impact their balance. You'll see them kind of always walking to one side a little bit. One of the reasons why those things might happen. But certainly really impactful, and they can feel really awful and just dizzy, maybe a little nauseous, just off all the time. Reduced depth perception, again, for many, many different reasons that this can happen. These visual perceptual difficulties also extend into things like figure ground. So, if I'm holding up a pen here and I want you to look at that, that would be the figure while I'm in the background, and you're able to pay attention to this, even though this is all back here, that could be a little bit more difficult. Maybe discrimination, so knowing the difference between a pen that I'm holding up versus a pencil, even though they might look kind of similar. Form constancy, so this pen is still this pen even if I've flipped it upside down. So those are some of the other visual field or visual perceptual difficulties we might see after a stroke. Reduced visual acuity. So, our reduced ability to see, again, whether that's from a prescription change or from a visual field defect or from something else, it is quite common, and we want to do the best that we can to support that patient with the proper pair of glasses and the proper prescription. But this also might be due to a reduction in what's called contrast sensitivity. So, for example, on this screen that you're looking at right now, we've got black font on a white background. That contrast is really high. But if somebody's reading the newspaper or driving at dusk or dawn or trying to read a menu in a dim restaurant, that's when our contrast is a lot lower. And sometimes the visual acuity for a patient after a stroke, when we measure it black on white, is really good. But if we make that contrast lower, they have a significant decline in what they're able to see. And so are there tints that we're able to use or other techniques that we're able to use to get them to see a little bit better? Dry eye is another really big one after a stroke, actually also after traumatic brain injuries, concussions, and so on. So happens again for many, many different reasons. Poor sleep is a really big one. When you're not sleeping well, your body is just more pro-inflammatory. We're getting more dry eye from that. There's a whole bunch of things that we're starting to learn about sleep and dry eye. After a stroke, we tend to blink less. So that's another factor in our dry eye. We also might have an incomplete blink. If our facial nerve is impacted, we're not not able to make that complete blink, or maybe we just have an eyelid that's not able to blink at all. Maybe it's coming down a little bit. Maybe the trigeminal nerve is impacted and we're not actually getting anything from the lacrimal gland. That's what's producing our tears. That's just not producing any tears because we're not getting that feedback. We could be seeing a neurotrophic keratitis. So the cornea has no sensation. The nerves there are not functioning properly. So there's no signal going to the brain to say that the eyes need more moisture. So these are just some of them, lots and lots of different reasons why we can end up with dry eye after a stroke, but really important for these patients to get them feeling better. Light sensitivity, again, so many different reasons why this can happen, dry eye being one of them. But after a stroke, we definitely can see a lot of light sensitivity. So again, tints, what can we do there? Getting them the proper prescription can really help. Just what can we do to maybe help out that patient and get that light sensitivity to be a little bit reduced? And now you have a little bit more of a list of things that can happen. I mentioned we were going to talk again about driving and the vision requirements for that. I didn't have a great place to pop that in, so we're just going to talk about that really quickly here. So our vision requirements for driving in Alberta. Again, this is a reference slide for you. You don't need to know this, but know that we do have requirements here in Alberta. Of course, I'm sure you kind of assumed that. This is something that we will be checking when we get that patient into our clinic. So we're going to make sure that they meet the driving standard. We have a standard for visual acuity, how well they can see, and also a standard for their peripheral vision, so what they're able to see in their periphery. When we test for that peripheral vision, it's a bit different looking than the previous one we looked at. It's much wider and it's tested with both eyes open. We just want to know if they can see anything in that spot, not how sensitive that spot is. So it's a little bit different. Here you can see, I think this is actually not a stroke that I've pulled up. This was something a little bit different, but it would look very similar to this for a stroke patient where we can see, there's like almost one entire quadrant that's missing. And this patient would unfortunately not pass the driving standard. In Alberta, the requirement to report that the vision requirements are not met is on the patient, not on the practitioner. So as an optometrist, when we see something like this, we have to talk to the patient. We will, of course, inform them about what's going on and talk to them about it. We're going to talk to them about their visual acuity as well. But then it is on the patient to report it. We can send a letter into the registry. We can also send letters to family doctors and so on so that everybody is aware. But it's not on us to report anything here in Alberta. What can we do treatment-wise? So when we're talking about all of these different things that we have and that can happen to us post-stroke, what are the treatments that are available to us? Because there are quite a few. Glasses, we've talked about this a little bit already, but making sure that that patient has the correct prescription, it can make a huge difference, especially if somebody is struggling with reading, getting them something to help them read. That's a big thing that we can do, whether it's reading or puzzling or Sudoku or anything like that, making that clearer for the patient after they have a stroke is huge. We also want to make sure that they're in the correct style of lens. So, I talked a little bit before about an optician doing that. An optometrist helps. We work together to make sure that we have the right thing for that patient. If they were wearing a progressive prior to having a stroke, this is where we have the distance at the top and it fades into a reading at the bottom. It might not be best for them after a stroke, especially depending on what's going on with their vision. We have some more peripheral distortion that comes along with that. So if they've got a lot of imbalance or a lot of dizziness, that might not be the best lens for them. We might want to separate that into two different pairs. So lots of discussion happening here when we're talking about glasses. Again, not just what do we measure and what do we prescribe from that measurement. Prism, this is another big thing that we can incorporate into glasses. Whether we're correcting double vision, we're helping out with reading, we're improving their visual comfort, or maybe improving their visual field awareness. So we're going to talk about that one in just a second, but I want to go back to the reading here. So if somebody is missing part of their visual field, let's say over to the one side, as they are reading, it's going to be quite difficult for them. We can't use Prism to magically give them all of that part of their vision back. As you know, it's just, we can't do it. We can shift things a little bit, we can make it a bit easier, but we can't magically give it to them. But if somebody's visual field defect is just right on the cusp, we can use Prism to just nudge things over that little bit, give them a couple of extra degrees of visual function, and then they move their book over to the side, and that can make a big difference for them in their ability to fluently read that page. There's lots of other techniques that go into this as well. It's not just the glasses, but we can do some small things like that that can make a big difference for that patient in their day-to-day lives. Okay, I mentioned we were going to talk about visual field awareness. Again, I can't make that whole visual field suddenly appear again. Although there are some studies to say that you doing some rehabilitation can help to maybe expand and recover from visual field loss that have come out. So that's pretty exciting. So glasses, they do not expand the visual field, but they can help a little bit, and it depends on the person. So if you're looking at this, I just have a little diagram here. If you have normal vision, this is what you would see if you were looking at this set of wild animals here. We're at some kind of crazy zoo. On the left side, we have the gecko, we have the elephant. If you're missing your visual field on that side and you look at the same thing, this is what you're going to see instead. We're missing that gecko and that elephant. Things start at the cat here. If you move your eye over to the side, you might see that elephant there, but we're still missing the gecko. And so if you were, example, walking through some kind of environment, if there was a pole over there, you still might not see it, you still might bump into it because even though you've looked over, you haven't looked far enough and your visual field is still, missing that area for you. So we can use prism on a certain section of your glasses, and this is for a very specific person to actually create what's called visual confusion. So now we've got this pair of glasses, we've got prism on the left side of it over here. And now we're looking through that prism. Now we have a gecko overlapping on the elephant. We've purposely done that so that this patient can say, oh, there's something over there. I'm going to look further to make sure I know what it is that's there. And I can now avoid that thing that was maybe in my way as I was navigating through my life. So this is, again, very specific. It's just one example of something that we can do with Prism. And it really depends on the person whether or not they would like something like this. So glasses, really important, huge part. Absolutely every optometrist can do this. Absolutely every optometrist can also provide dry eye treatment and will provide dry eye treatment. So this is something it's really overwhelming when you look at this slide. And I've done that just to try and highlight all of the different dry eye treatments that we have available to us. There are so many different things, and it really comes down to what is the primary cause of that dry eye. Because one treatment is not the same as for one person as it would be for somebody else. It's not as simple as, grabbing an artificial tear and putting that in your eye. That might work for somebody, and it might temporarily work for somebody else, but it might not work at all for a third person. So we really need to be able to look at that eye, understand what's going on, and then pick and choose the things out of this massive kitchen sink here to know what's going to work best for that patient. Some optometrists will also provide an advanced level of care in this dry eye. So, these are the basics that any optometrist has access to. But at that next level, some optometrists will have more advanced equipment like intense pulse light or radio frequency, low level light therapy, things that we can do at that next level to really, really help that dry eye if our other treatments aren't working. Also, specialty contact lenses can help with dry eye as well. So just a huge, massive world here. Vision therapy is another one that we can provide, and I chatted a little bit about this one before. Vision therapy is about evidence-based exercises to improve visual skills in the visual system. So again, we're thinking here along accuracy of eye movements when it comes to patients that are post-stroke. Some of those visual perceptual difficulties like visual memory or depth perception, and to help them out with that. This is an area where optometry and occupational therapy will really overlap and work well together because we're training slightly different things. Same kind of idea, but an occupational therapist is really going to focus on the scanning training, incorporating this into the day-to-day life into a full body program. A vision therapist or an optometrist providing vision therapy is going to maybe just make it a little easier and more accurate for that eye movement to get over there so that when the OT is doing everything, we're really getting the most out of that type of training. A couple of different websites there on the bottom where you could search for an optometrist who provides vision therapy services. And the photo here, these are just some of the equipment that we might use. I have a couple of other photos here that we took in our office. They're shared with permission of some different patients doing some other vision therapy things. So lots of equipment that we can use here. And low vision also uses a lot of equipment. So when we have an optometrist providing low vision services, they will do a visual assessment as well as a needs assessment. And based on that, pull up the different tools that are going to be beneficial for this patient. Is it a magnifier? Is it a telescope? Is it something like a different tint? What is it that this patient needs to make things the most comfortable for them? They'll also talk about techniques and strategies to manage these visual impairments. And along the low vision devices and rehabilitation, we also have, in particular, the VLRC here in Canada, which is Vision Loss Rehab Canada. They provide a lot of those rehabilitation services, mobility, instruction, technology training, assistance with the ADLs and with different tasks that people are doing throughout their day to day. They used to be with the CNIB, which is the Canadian National Institute of the Blind, or for the blind, excuse me. But the CNIB now focuses more on advocacy and some community programs, whereas the VLRC is really getting in there in the nitty gritty with the rehabilitation for patients. So a role for all of this, they kind of play in this low vision world as well. And you can refer directly to VLRC, but as an optometrist, we're also happy to do that and make sure that this patient gets the care that they need. So we spent a lot of time talking about the background. Let's really get into our stroke pathway that we have. So this is the long name of it is the Provincial Eye See After Stroke Interdisciplinary Vision Care Pathway. And so let's dive in. Have it here as a big overall arching view again, so you can take a screenshot of it, so you can do what you want with it. But we're going to dive into these different pieces here. So let's start off on the top section. This will always start off if you're in a hospital, you're going to be starting here. If you're not in a hospital and you're seeing this patient come in, you can still be looking at this. You can still look at it and make sure that none of these things are happening. So this is applicable really anywhere, but you'll see as we kind of go through it that it is tailored a little bit to those inpatients immediately after stroke. But absolutely, if you're seeing somebody after and they still haven't had their vision checked, this absolutely applies. So starting off with the history, we want to know that this person had a confirmed diagnosis of a stroke. This is again presenting in hospital. If this is somebody that you've seen later, maybe even years later, they have a stroke diagnosis, but they can't provide a lot of information, but they're struggling, you can still follow this pathway to get them the appropriate care. Once we have that history, we know that the stroke has happened. The first thing we want to make sure is that we don't have any red flags in the vision. We haven't had a sudden onset of complete vision loss in one eye. If the stroke has happened in the brain, there is a chance that the stroke could happen in the eye. And so if we're seeing sudden onset, really quick, absolute loss of vision in one eye, we absolutely need to get that person off to see on-call ophthalmology right away so that they can get treatment, hopefully, to save as much vision as possible. If that's not the case, we're going to move on to our next step, which is our vision screen. Whether you're doing this immediately in the hospital or maybe you're not, you're just seeing some of the results, this is really helpful to understand a little bit about what's going on and where to direct that patient afterwards. So this pathway is saying that within 72 hours or when the patient is cognitively able, a visual screen should be performed. It includes lots of different things that you can see here. And I've put a little purple star there on the top right, and then on the bottom left, this is the screening that's being used. So this is the VISA, or the Visual Impairment Screening Assessment. If you go to the link that's there, you can actually download all of the resources. There is a full guide on how to do all of the tests, as well as some of the actual tests themselves, and videos on walking you through how to do these tests. So even if you're not in the hospital, if you are, here it is. If you're not, can still be really helpful to direct where you're wanting that patient to go next. If the patient has something that comes out of this visual screen, something is going on, we've done a brief visual assessment, but we're finding something, we need to go to that next level, then we are going to look at the next piece of our pathway. So if we're noticing on the far left side here, a difficulty with visual acuity, reduced visual acuity, or we have a concern with ocular health. They're complaining about a lot of dry eye. Maybe you're seeing some really heavy blinks or something like that. That's when we're going to get this patient in to see an optometrist or an ophthalmologist within a month if we can. Again, there's going to be some variables there that might change that, but if we can do it within a month, that's great. That way, the optometrist or the ophthalmologist can assess the vision, can assess the ocular health, and get them the proper care that they need. If we move one in from there with that kind of teal or turquoise color there, if we're seeing a difficulty with eye movement or position, this is where you're going to refer to ophthalmology or optometry again, and within 1 month. This way, again, we can assess the double vision, we can assess what's going on with the eyes and get that patient the treatment that they need. If this patient is still in hospital, they would go to an occupational therapist to do whatever they can until they can leave and they can go and see an optometrist and or an ophthalmologist if it's still needed at that point. Really quick, one thing I haven't talked about yet, orthoptist. So refer to an orthoptist through ophthalmology. An orthoptist is somebody who looks at the ocular motility and visual development. They treat a non-surgical or they don't non-surgically treat amblyopia, strabismus, diplopia. They deal with the glasses and the prism and all that kind of stuff. They just work under ophthalmology. They're going to be the ones who are comfortable prescribing the prism. Sometimes the ophthalmologist, but typically it's the orthoptist working for them. So haven't really touched on them too much yet, but they definitely huge role to play here. And whether you can get in to see an orthoptist, you can get in to see an optometrist, and where that pathway goes, getting somebody in to see one of those is the important part. Moving on to the yellow, here's where we have our visual field impairment. So this is the really big one. Again, sending this to optometry or ophthalmology so we can do formal visual field testing. In the visa, in the assessment, the initial brief assessment, you're doing a different type of field. That's a confrontation, so you don't have an actual clicker test that you're using to check formally the peripheral vision. So if something flags, you're going to send in for that formal testing. As a quick aside, there are some virtual reality visual fields that are now becoming available. So that might change this pathway a little bit and change the type of care that we're able to provide and what we're able to detect in a hospital setting still, which is very, very exciting. If we are seeing a visual field defect, the optometrist or ophthalmologist will be monitoring that patient every 3 to 6 months until we're seeing stability. There is a chance there's in the first 3 to 6 months that we could see some of that visual field defect go away as the brain heals, the visual field might come back. The chances decrease after that, but certainly not impossible. If we're seeing some difficulties from that visual field deficit in a lot of their navigating through the world and their ADLs and so on, again, we're going to look at doing occupational therapy or optometry, maybe both actually, to get that patient the care that they need. Last but not least, on the end there, we've got visual inattention or visual perception difficulties. We have occupational therapy here, especially in a hospital setting. Again, there's a little bit of a role here where optometrists can help, but this is where occupational therapists and optometrists are working really well together to get the patient the care that they need so they can see a lot better in the future. Once we move on from our referral, just a quick note here, there's these the three that were on the left side about optometry or ophthalmology. We also have neuro-ophthalmologists, and that's almost a next level above an ophthalmologist. So they're really that kind of highly specialized care. So if we're seeing a really complex case, some complex visual field impairment or unique eye movement patterns, some nystagmus or something that's going on, this we can really reach out to them. If you're not sure if your patient needs to go to that level or where they should go, you can absolutely refer to an optometrist first, who can then refer from there to the appropriate specialist and make sure the patient gets the care that they need. It's absolutely, we will refer for sure if we're needing to. So you don't have to worry too much about who is the proper person to go to. The patient can get within the system and then get to that next level if they're needing it. Again, reminder, if the patient is struggling a little bit with activities of daily living, not only are they maybe going to be seeing an OT, but we want to involve Vision Loss Rehab Canada so that patient can get a lot of the care that they're needing. From there, we want to make sure that the patient is educated on everything. So you'll see both on the green box on the left and then the very bottom number 5 there under management. We want to make sure that the patient is really aware of everything that's going on. We're going to make sure that, they have had a chance to ask the questions that they need. But we also want to make sure that other healthcare practitioners involved in this patient's care have that information too. It's really important for you to know that, this part of the visual field is not functioning as well so that you can tailor your treatment and stand on so something as simple as standing on the correct side of that patient so that they can interact with you a little bit better. So seems really simple for something like that, but it can make a big difference in this patient's care if you also understand what's going on. A couple of things here that you can see, we have return to driving resources here. So a couple of different resources that are there. This is on the My Health Alberta website. If you search stroke on the top right, these will pop up. I think there's some brochures coming out as well with a little bit more information than even these, but they just don't have a home yet. So that's one thing. Here's the whole pathway again. This pathway has been finalized. However, there's no home for it at this time. So it's not something where you can find it really easily on the My Health Alberta website or anything from Alberta Health Services. So it's getting a home. It's not going to just float around for forever. But for the moment, you have it available here for you, and hopefully it'll be available for you somewhere easily accessible in the near future. So now that you know where you're going to go for these different things, let's talk a little bit about what the patient has in terms of coverage for some of these assessments. If we're talking about Alberta healthcare coverage, Alberta healthcare has partial coverage towards routine eye exams for people who are 18 and younger and 65 and older. We also have partial coverage for specific health exams, for emergency eye exams, for dilated eye exams, and for imaging, visual fields or imaging of the back of the eye or scans of the back of the eye for all ages. So if you need it, we can do it. But it's a little bit different. I say partial, and that's because back in January, you might be aware of this, there was a change to our funding from Alberta Health. So we have a few changes. The big ones that would impact our patients post-stroke. Alberta Healthcare no longer covers a routine eye exam and a dilated eye exam on the same day. So if we have a patient who comes in with a stroke, we would do a routine eye exam on one day and then bring them back typically on another day to do that dilated eye exam so they can get both partial coverages towards those exams. Frequency of our retinal imaging and photography has reduced. So if we're actually doing pictures and such scans of the back of the eye, we can't do them quite as often. Thankfully, the big one for our stroke patients, the visual fields, we can still perform just as many of those in a year. A couple of other changes there too. The amount that we got is reduced and the partial exams is reduced as well. But thankfully for our stroke patients, there shouldn't be a whole lot of change for them in those other areas, which is great. So partial coverage, you might see some optometrists accepting it as full coverage and some optometrists accepting a balance bill, and that is entirely up to the individual office and what they offer. But the good news is that we have a lot of coverage towards these different types of eye exams. So, we at our clinic are always going to work with the patient to make sure that they get the care they need, especially after stroke if they're struggling financially. So if you're needing care from an optometrist, how do you go about that? How do you find somebody? We do have a Find an Optometrist feature on the association website. So if you go to the Alberta Association website, on the top right, there is a Find an Optometrist feature. If you click on that, you can search by name, location, or you can also narrow it down. If we have a patient who has had a stroke and they're in a wheelchair, you need a wheelchair accessible clinic, you can click that off. I think that feature is going to be a little bit more robust soon. So there is some of it there, but I know we're just working on it a little bit. So, if you know that there's a clinic that's wheelchair accessible, but it's not listed, go by the fact that you know that the wheelchair or that the clinic is wheelchair accessible and not the fact that it's not listed on here yet. It will be soon. Lots of other resources available as well on the website. So this is what our homepage is looking like right now. Lots of resources you can see for health professionals at the top there. One quick thing to know is that no referral is required for your patient to see an optometrist. It is appreciated. It does make for easier reporting and better collaboration with you, better co-management so that the patient gets the care that they need. But it's not necessary, and it's not necessary for them to get the Alberta healthcare coverage towards the exam either. You can go here. I've got this little, the drop down under for health professionals. You can see it says referral forms there. So you can actually go online and download a fillable PDF or a printable form there to get a form. There is a little checkbox that you can say for post-stroke assessment. If that's all the time you have, that's great. Having your name is really important so that we can send a letter back to you as well so that you can get it. You can also order printable or like pads of these referral forms if that's easier for you. And again, that website is optometrist.ab.ca. So in summary, optometrists, the kind of little thing is that we're the family doctors of the eye care world. It is important to have both routine eye exams and eye health exams after stroke. They're providing us with different information, both of which is really important. And we do have certain advanced care for ocular and visual concerns after a stroke. Stroke can impact a lot of different areas of our vision, visual field being the big one, but so many other things can be impacted as well, where an optometrist can really help that patient. And that patient can benefit from Alberta healthcare coverage towards the eye exams that they're needing and towards the imaging that they're needing. Remember that no referral is required, but it is appreciated for the best patient care and for co-management of the patient. So I think that's everything that I've got here. I'm just going to make sure that I can see any questions. I actually didn't mention that at the beginning, but if you do have any questions here, feel free to pop it into the chat and then we can certainly answer those if you've got any. I saw a hand up, but then it went away.
While we're waiting, when we close the webinar, there's going to be a survey that pops up. We'd really appreciate you taking 2 minutes to complete the survey to help us continue offering CE for our allied health friends and colleagues. And if there aren't any questions right now, but they come up for you later or you're watching the recording, you can direct them to the association and we will find an answer for you. We will get the
Yeah.
question to Dr. Franco.
Yes, definitely. Yep, for sure. Well, thank you so much. Not seeing any questions come in. I know there's not a ton of us here right now, but hopefully lots of people seeing this later. So thank you for taking time out of your evening to join us, to watch this talk. Hopefully you found it informative. And please fill out that survey after because it does really help us to make sure that we also get you the information that you're wanting to see. So I think my favorite of these little jokes that I have over here is what you call a fish with no eyes, which is psh. So with that, thank you for coming and hope to see you soon and hope you found this helpful. Thanks so much.
Thank you, everybody, and good night.